Going to therapy is becoming more normalized, but most people are still very wary when it comes to psychedelic assisted therapy. What is it exactly? Is it safe? Does it have side effects? Certified psychedelic assisted therapy expert Dr. Mike Dow joins us now to help answer those questions. And it's great to see you again, Doctor. Tell us about...
Nice to see you again, Tracy.
Yeah, good to see you. Tell us about how and why you got into psychedelic assisted therapy training.
Well, it's so interesting. I've been in private practice in Los Angeles for 10 years. I've written 7 books on mental health, brain health, and I was reading all of these studies, and I knew that for both my patients and the world at large, I just had to get trained in this. So it was a couple of years ago before the pandemic, and I can't tell you, Tracy, the life-changing experience I had, and I knew that this was going to actually change some lives, and especially since it's Canada's Mental Health Week. I think it's really interesting that there are 6.7 million Canadians who suffer with mental illness who deal with that, but 49% don't ever see a doctor because of it. So I really think that psychedelic-assisted psychotherapy can be that answer for so many of those people.
Now, I hope it's okay if I ask this, Dr. Dow, but I know that you wanted to learn it for your patients, but also you needed it personally as well, because you've gone through some stuff in the past year that has been quite tough. Are you okay to talk about that?
Yeah, absolutely. So I lost my grandfather to COVID this year, and I think for so many of us, we know that mental health is really a combination of genetic loading and experience. Your life experience, your environment. And for so many of us, I think the pandemic, whether you're somebody like me and you've suffered a loss, somebody you love dearly, or just the stress of losing a job, isolation, it can sort of turn on those genes. And I know for me personally and in my professional practice that psychedelic-assisted psychotherapy can really help people who are suffering out there. I think we need it now more than ever.
Okay, so break it down for us. Maybe you can explain what ketamine-assisted therapy is, and is it safe? That's what everyone wants to know, I think.
Yeah, so in Canada, there is one medication that is currently approved for psychedelic-assisted psychotherapy, and that's ketamine. So in Canada, you're going to be using this very safe drug. It's been used as an anesthetic since the 60s. Even in an ER setting, if a kid is going in and breaks a bone and you need a really quick and safe anesthetic, you can use ketamine. But then we discovered something really interesting 20 years ago, around 2000, that it is probably the most fast-acting antidepressant medicine that we have. And then also you have this really interesting side effect. It creates dissociation, meaning you have this state where you feel like you're leaving your body. Some people say it feels very spiritual. You feel light. You feel very at ease. And it really creates this perfect state, combining a medicine with psychotherapy. You're sitting with somebody like me or another field trip therapist, and it really allows you to go deep and to really untangle the knot that for so many people is very complex when it comes to depression or anxiety.
Okay, so how does one get access to this therapy, and who's eligible for it?
Yeah, great question. So it's a little different in Canada than the United States. In Canada, it is approved for treatment-resistant depression. That means you've probably tried and failed a couple other treatments, maybe a medication, maybe cognitive behavioral therapy. Either it's not working at all or it's not working enough. You need a referral from your doctor, so ask your doctor to refer you to Field Trip. And by the way, our meeting with our psychiatrist is covered by OHIP in Canada, so that's great. And then if you're approved, you're going to have about 10 total sessions over the course of a couple months. 6 of those sessions are going to be the ketamine-assisted, so medication plus psychotherapy. You're going to be sitting in a room. It's going to be really comfortable, music, eye shades. It lasts a couple hours. And then 4 sessions of what we call those integration sessions. So in between those medicine sessions, you're going to be making sense of your experience, talking, sort of a more traditional talk therapy.
Does ketamine help you just lower inhibitions? Is that what's happening, so that you feel open enough to share maybe some of those deep thoughts that are hard to dredge up? Is that part of it?
Tracy, that's absolutely it. It has what we call sort of this empathogenic effect, meaning it helps you to open your heart. It helps you to actually talk about the things that are really at the core, I think, of depression and anxiety. People who come through our program, it's really interesting. They come to us with an average rating. We use a clinically valid scale. They come to us with severe depression. By the time they are done with our program, on average, they rate their their symptoms as minimal.
And there is sort of a litmus test. You had to have gone through 2 failed other sources of trying to get at your depression or your mental health issues before you can try this one, right?
That's correct. And
Okay.
there are some conditions that aren't a good fit. You know, for example, schizophrenia, psychosis. This is really a great treatment for people with treatment-resistant depression and also some anxiety.
This is so interesting. We're going to get into a little bit more now because joining us now is Shayona Panth, who has very graciously agreed to chat with us about her experience. So tell us about your experience with ketamine-assisted therapy. What was it like for you?
Well, it's a pretty recent process for me. I've been involved in the process for a couple of months now. And I'm doing well. The way it started for me was that I'd been taking SSRIs for some time, a number of years actually, and they had been very effective for me for some time, but I was finding they weren't working optimally, and I'd kind of hit a wall. I was feeling stuck. I started doing some research of my own and learned that ketamine therapy has been really effective for some people. And so I became curious. And then I got a couple more recommendations, I guess, for field trip. And a lot of things about that experience sounded suitable for me. So I decided to try it. And it's been a really valuable part of my journey and my healing and my therapy.
It's good to hear now from 2 people who have tried it and tried other things. You said SSRIs, so for folks that don't know, like antidepressants, were not optimal for you. So this is sort of the route you took, and you're seeing some effectiveness there. So I appreciate you sharing our story with us. It's not always easy to talk about these things on TV, so thank you so much for doing that, Shayona.
Thank you for having me. I appreciate it.